The flu, no, it's not COVID, but it can kill. And unfortunately, already there have been 3 deaths in children from the flu this year, just this past week.
And health officials say get your flu shots because this might be a very tough flu season this year. The CDC says they're already seeing flu and similar illnesses at notably high levels in some of the southern states, as well as New York and Washington, D.C.
Given what we've seen in Australia this summer, our summer, their winter, it's reasonable to expect we're going to see a significant flu season this year.
Okay, so how do we prepare for that? Joining me now is pediatrician and internist Dr. Frita Fisher. Good morning, Dr. Fisher. I think the first thing I want to say, though, is I almost want to put a little context in it. We're not dealing with COVID. That feels so good, but we don't want people to forget that we could have a tough flu season.
We absolutely can. And I think we got spoiled a little bit, even though we had the dreadful pandemic, of course, because everyone was wearing masks and doing the hand washing and all the precautions were in place in schools and in public places. We also protected ourselves from the flu, so much so that we hardly had any flu cases over the last 2 years. The flu, no, it's not COVID, but it can kill. And unfortunately, already there have been 3 deaths in children from the flu this year, just this past week.
So if your kid is sick, is it important for a parent to know if it's the flu or COVID? Should they still be testing? What do they need to know?
Yes, they do. And you can get tested for the flu. You can get tested from COVID. You can do both tests at the same time. What people need to do is pay attention to the symptoms. Now, some of the symptoms do overlap. With the flu, you can get cough, you can get fever, you can get sore throat, similar to cold symptoms, similar to COVID symptoms. With the flu, however, those fevers really tend to spike pretty high. There are some treatments available, and also there can be complications such as pneumonias. There can be viral pneumonia, bacterial pneumonia, even inflammation of the brain, encephalitis. And so if parents are suspicious, they want to know what they're dealing with, so they do need to go see their pediatricians.
All right, before I let you go, the FDA did talk about a shortage of Adderall. How tough of an impact is that on kids? What can people do?
It's very serious, since the Adderall is something to treat ADHD, which affects many children and adults for that matter. It takes the right medicine to work for the right child. Many children will take certain anti-ADHD medications and they may make them have really flat affects or just really dull personalities, or they can make them lose their appetite, or they can give them a hyperactive reaction. And so when parents find the right drug for their child and then there's a shortage, it can be an issue. The good thing is that there are some substitutions, for example, some extended release versions of drugs similar to Adderall. And so I don't want parents to panic. Just talk to your pediatricians, find out what substitute you can use temporarily, and hopefully the shortage will be over very quickly.
Dr. Frita Fisher, my kids are 8 and 11. When I go into a store, I'm still wearing a mask, and they're kind of like, well, we don't have to wear it at school. What should I tell them from you?
You should tell them that Dr. Frita said that there are more things to protect themselves from than just COVID. If they don't want the flu, if they don't want nasty colds, if they don't want to have to miss school and parties and perhaps sports because of getting sick, then they need to listen to Dr. Frita and their mama and still put on their masks, especially now that flu season is here.
All right, you're my favorite kind of doctor. Thank you for the work you do.
Thank you.